September, right? They call it a Medicine Life Review Committee. I think a lot of people don't know this. They just talk about other things. And I noticed one thing about this is healthcare review, right? So why does they have like they have like 9 corporate bodies, accountant, life insurance people, they are not involved in healthcare, are doing these healthcare things. It's led by Mr. Bobby Chin, I think, the chairman, and IBM director, I don't know. All of these kind of people are doing healthcare for bid, for you and me, our CPF. I find it quite confusing. It's only 11 people in the committee, and only 3 are involved in healthcare. One is a nurse. I don't know whether she knows about how much a bed costs. One is a doctor, and these 3 is only 1 doctor, 1 nurse, and 1 general practitioner. And 9 of them, 8 of them are from corporate world, insurance agents. Okay. So this healthcare thing, one more thing, this healthcare thing, my question is it because of payment, or is it because of taking care of our CPF? Or is it trying to increase premium? Because I don't see any healthcare benefits from the committees. I think they have a power itself, I think 7 November. And I think MOH have already come up with what they want to be for the committee to approve, right? And I get it from MOH website. So what my question is, what is the purposes of the committee and the healthcare and changes or something like that? Because I don't see any changes for the better. That's all.
Okay. Yeah, I think that's a very good point, Rashid. We were just talking about that. The composition of the committee reflects the priorities and the goals of what the committee is trying to do. So the committee is corporate. So it's made up of corporate leadership with a grassroots leader. There's one unionist. The doctor is actually my classmate who happens to be the CEO of Parkway. So he is a doctor, but he's coming at it from the perspective of somebody in the corporate environment. So the suggestion is that the goal of this committee is to make sure that the revision to MediShield Life is economically viable and continues into the great tradition, as Zihian has pointed out, of public insurance in Singapore, which is profit making. So I think that this is not going to be the ultimate solution. I mean, I wish them well. I'm hoping to go to one of the feedback sessions. But I think it's very important that, as many of you have said, that we have a voice. We've got one voice in Parliament who keeps asking healthcare questions. But it's good that these questions keep getting asked. You know, what is the voice of the patient? What is the voice of the GP? What is the voice of the person working in a public hospital? And I think that needs to be heard in this MediShield Life debate.
I think it's true that what the observation about the composition of the board of the committee is. But I think what is more important also is for you to look at what is the terms of reference that they've been given, what have they been told to look into, and what I would encourage everybody, all members of the public, is to actively participate in this MediShield Life review, because I believe there's a feedback session on the 7th of December, if I'm not wrong. Go and give your feedback, because that's really the opportunity for them, for your voice to be heard. I don't think it's wise for us to take a cynical view of this, because I think this is a once-in-a-lifetime revamp of the MediShield Life, MediShield system. And if we miss our opportunity this time, it might not be a long time more before we can revise it. So, which is why I've been pushing things like premium subsidies, because I want to plant it in their minds to change it before the decision is made. Once the decision is made, it's very hard for them to change, because it will be an admission of failure if they change it.
If I may, I agree with you entirely. It's a pointless exercise unless, a lot has been written about MediShield Life and about the committee. I can't wait to see when, if ever, they will ask the fundamental question as to why does the government not spend a single cent on MediShield? Why is MediShield the most profitable national health insurance scheme in the world? And why does the government not spend a single cent on healthcare as well? Unless these questions are addressed, like someone said earlier, we're just beating around the bush,